What I'd like to do in this video is go over the things that we do in a typical adult eye exam. This will give me the opportunity to show you some of the equipment we use when we check your eyes. So let's go ahead and start over in the pretest room. Okay, so this is our pretest room, and all the machines you see around me allow us to gather important data before the doctor sees you. Now, before we use any of these machines, we make sure that we take a few minutes to take a brief case history from you. And this is your opportunity to basically tell us why you're visiting us. Now, the obvious reasons might be getting a new pair of glasses or a new pair of contacts, but there might be other reasons that you're here too, and it allows us to take a look at those and see if there's anything else we need to address. Okay, so the next step is to check what we call your visual acuity. And this is just a fancy way of saying that we're going to test to see how you see with or without your correction. Now, this can be done with a standard eye chart that you just hang on the wall, a projected chart like what we have in the exam lane, or a tester like this. And this presents different targets to the patient and even allows us to measure your depth perception. Alright, so following visual acuity, we now use a machine called an autorefractor autokeratometer tonometer. And that's a mouthful. Basically, it's a machine that combines three into one. The autorefractor is a machine that gives us a ballpark figure of your prescription. Now, these numbers can be pretty accurate, but they still need to be refined in the exam room with a process we call a refraction. The keratometer is a machine that measures the curves of your cornea, and this is helpful with assessing astigmatism and also measuring for contact lenses. The tonometer is the dreaded air puff machine, and this is a way of measuring the pressure in your eye, which is one tool we use for screening for glaucoma. The pressures can also be measured with another tool called a Goldmann tonometer, and that actually touches the eye. So the advantage of the air puff is it doesn't require any drops. It does give us a pretty good measurement, but if we do see suspicious signs, we'll definitely recheck it with the Goldmann. Alright, so the next device we use is the retinal camera, and this is a specialized camera that allows us to take a picture of the back of your eye. It's a great way to document what your eyes look like on that particular day that you come in, but on a year-to-year basis, it gives us a good record to compare so that we can see if there are any changes taking place. Patients also find it interesting to see what the back of their eye looks like. Alright, so the next machine we use is a corneal topographer. Now remember, the first machine already gave us some measurements of your cornea, but this goes a step further and provides an actual map. This is useful because it assesses the entire cornea, and it's a great tool when dealing with corneal problems that require special attention. So we utilize this machine with contact lens fittings, but also with LASIK co-management, following corneal degenerative conditions, and specialized contact lens fittings. And this one here is a visual field analyzer. The purpose of this test is to assess your peripheral or side vision. Every patient that gets a comprehensive exam receives an automated screening field. If we see anything suspicious, or if we see other signs in the exam room, this computer can carry out more comprehensive tests to help analyze your fields even further. Alright, so in addition to all those tests, we also take your blood pressure and we do a color vision assessment. Then the patient is moved to the exam lane. Now that we're done in the pretest room, the patient is moved here to the exam lane. Here the doctor refines your case history and then proceeds with checking your eyes. The first few tests we do at the beginning check muscle balance and movement, and then we move on to the refraction.
This is the infamous which one's better, 1 or 2 test. The refraction refines your prescription and your eyes are tested to see how they function both at distance and at near.
Afterwards, we move on with the slit lamp.
This is a special microscope designed to examine the structures of the eye. It provides the doctor with a close, detailed, three-dimensional view of both the outside and inside of your eye.
Okay, so there's one other part of the exam called the dilation. Now this is where the doctor uses eye drops to dilate or widen the size of the pupil. The drops basically make them unresponsive to light, and by doing so, allows you to obtain a much wider view. Now we use two instruments to conduct this part of the exam. One is a binocular indirect ophthalmoscope, or BIO, along with a condensing lens here, which helps to direct the light from that instrument into the eye.
In contrast to what can be seen with the standard scope, the BIO gets you out to those peripheral areas that are typically not viewable. This is important because it allows us to check for certain degenerative processes or things that can predispose you to more serious conditions of the eye, some of which could potentially threaten your sight.
So dilation will leave you light sensitive over the next few hours, so it's important that you use sunglasses when you leave the office, or consider having someone drive with you if you have a long drive ahead. Hopefully in this video you've learned a little bit more about what's involved in a typical adult exam. For children we do a few things differently, but I can leave that for another time. If you have other questions, feel free to drop on by or visit our website at www.mmoweb.com. Thanks again for watching, and I'll see you next time.